This YCN segment is brought to you by La Valley Building Supply and Middleton Building Supply.
Today on Home Care Matters, the JAMA report looks at new medications for high cholesterol being not cost-effective. I'm Jim Culhane. Lake Sunapee Region VNA and Hospice provides healthcare and hospice services, allowing continuity of care and helping people to stay in their homes as long as possible. To foster this mission, we provide the most up-to-date information about healthcare advancements, procedures, and products. In this vein, we present this edition of the JAMA report.
Millions of people struggle to lower their LDL or bad cholesterol. A new type of therapy called a PCSK9 inhibitor can help reduce LDL or bad cholesterol by nearly 50%.
They block a specific enzyme in the cholesterol pathway. In doing so, they increase the removal of LDL cholesterol from the blood into the liver and lower LDL cholesterol levels.
They were approved to be used for individuals who are at higher risk for heart disease, who have had a heart attack, a stroke, or who have a family history of very high cholesterol. These drugs were approved to be used in addition to the statin medications in these particular individuals.
Doctors Kirsten Bibbins-Domingo and Dhruv Kazi from the University of California, San Francisco, and their co-authors examined the cost-effectiveness of PCSK9 inhibitors and their potential effect on U.S. healthcare spending. Using a simulation model that included all U.S. adults age 35 and older, they evaluated outcomes like expected number of deaths due to cardiovascular disease, heart attacks, and strokes, and balanced this with the cost and potential benefits of these drugs. The authors estimated that about 9 million people would be eligible for this therapy.
This innovation comes at a price. They were launched at a little over $14,000 per patient per year.
It would increase our total expenditure on prescription drugs by almost 40%.
The study appears in JAMA, Journal of the American Medical Association.
All healthcare expenses would go up 4%, and that's a large increase in our total U.S. healthcare expense based on one set of drugs alone.
Our analysis suggests that that price tag should be closer to just over $4,000 a year for them to be cost effective.
Should that not happen, we would expect to see an unprecedented strain on health system budgets across the country.
Catherine Dolph, the JAMA Report.